What do you suggest to a couple? For example, a couple comes to you, and the way a woman deals with infertility and the way a man deals with infertility is very different. How do you?
I always tell in my counseling sessions to a couple when they are going through this journey together that you're not alone. Both of you are partners in this. The girl is always crying, emotional stress, as though if it appears. Sorry to say, we all women have a habit of crying and making noise, right? Either you'll talk to your friend, your mother, your colleagues. You will certainly come out and discuss about your problems. Women have this nature. Women are women, including me or you.
Yes, that's true.
But for a man, he will never be able to discuss his issues with his parents or his colleagues or anybody, even in the chamber. When I see women are the ones who are more communicative than the males. And I tell them, I said, look, the rate of heart attacks is more in men than women. It's the stress taking this thing is more with the males and not with the women. Because women will have a outlet. They will certainly discuss, cry, talk it out, and be done with it. But for men, they will keep it close to their chest. So I always tell the female that, look, you are to be a support for your husband as well. If you are wanting to be a mother, he's wanting to be a father equally. So emotion is absolutely equal. The need is absolutely fair and equal. But an outlet given for a woman, she has many options to talk it out. And it's by nature she will talk it out. But for a man, he has nobody to talk, and he won't even talk to his wife because thinking she's already too stressed out. So why discuss this topic with her? So there is no outlet for him. So pity him out here.
Yeah.
And be a support.
Yeah. So leads me to the next question. Do we have like a call center or a resource center kind of a number where people can just dial up and stress, especially for males, right? Do we have a contact point, a phone number, an email, or somebody that they can reach out to and talk it out?
What we do is that we always have numbers of the couples who went through this journey with us, the successful journeys, the ones who had it in their second attempt or third attempt, and we take consent from them. Would you like to help another couple to, reassure them or encourage them throughout this journey? And we take signatures from them when they are leaving the clinic after a positive result, and then we share those numbers with the new ones.
Yeah, that is a very smart move because only people who have gone through it will understand what that other person is going through.
Yeah.
Yes. Ma'am,
so they should hear it from the other person's perspective, because as much as I may counsel or my team may counsel or my psychologist may do that, but somebody who's gone through it and faced a failure or having got it in the first attempt would be a better person to, give that emotion out, explain that emotion and that journey to another one who's about to go through it.
Yeah, and also understand what they're going through. And
that is group support. What do you call it as a group support for this kind of a thing? So we do build up our kind of group support within the clinic.
Okay, so you have got like a group support thing going on. Do you think people from other places can also join your group support, or?
They're open to join. They're open to contact us, and we shall provide it.
Okay, is there a number for us to maybe display?
Yes, we will be sharing that number.
Okay, great. Ma'am, who do you think needs IUI?
See, IUI is a form of a treatment which is a non-invasive procedure. Can be done in an OPD, no anesthesia, no cut, no suture is required. It is a simple IUI, means intrauterine insemination. Intra means inside, uterine means inside the uterus. Insemination means that you prepare the semen sample, wash it, get a good semen sample, and then inject that into the uterine cavity. It is like, if I can explain with this model.
Yes.
You see this? Yeah. So you just put a small, it's a very fine catheter, like a refill of a ballpoint, much thinner than that and longer than that. You just put it inside to this point and you inject semen out here to this point.
Can you lift it up a little bit? Yes.
So you just inject the semen inside the uterus, and this is how an IUI is done, right? Okay. So before the preparation for IUI is that you stimulate the ovaries, prepare 1 egg or maximum 2 to 3, not more than 3 eggs. You stimulate the ovary, follow it up on an ultrasound. When the size is about 18 to 20 millimeters on this side or this side of the ovary, you know that the lining of the uterus is a good 8 millimeter and above, triple line. You ask the husband, you give an injection which is HCG, and then 36 hours to 38 hours later of that injection, you do an IUI in your clinic, and semen sample is washed in the laboratory, and then you inject it, and then give support, luteal phase support, and wait for 14 days for the result to happen. But an IUI cycle has 10 to 15% result, whereas an IVF cycle has 50 to 60% result per embryo transfer. So IUI is done in very selected cases, chosen properly, where the prerequisites need to be met. There has to be a criteria for semen count. How much should be the count? What should be the tubes of the woman should be patent. Her age factor. There should be no other disease there, and there should be no all viral marker tests to be done beforehand. So once all those criterias are there, you have carefully selected that this patient should go for IUI. Best selected patients, in spite of what come may, the result is 10 to 15%. This is done in younger patients where there's subfertility. Maybe there's a mild derangement of semen count or motility. You can facilitate, or there's a cervical factor, or maybe there is some factor where the husband is, he's having premature ejaculation, or there is some traveling issue that the husband is always out. He's working in Navy, merchant Navy. He's not in town. He's frozen his sample, and the wife is undergoing IUI. Various other reasons for IUI, but if you've carefully chosen the patient, her tubes are patent, she's a young patient, and maybe just mild ovulatory dysfunction, you need to do IUI for that indication. In spite of what come may, the result is 10 to 15%. So carefully selected patients, yes, IUI is a good modality for ART treatments.
Thank you. Ma'am, which leads me to the next question. In your IVF clinic, you must use a sperm washing machine. How helpful is such a machine for you as a doctor?
Which machine are you talking about, Jani?
Any
IUI sperm washing machine?
Yes, any sperm washing machine.
Of course, we have an IUI lab in the clinic. We have an andrology lab. We have an andrologist and an embryologist working full time with us. Of course, it is a very good technique. We use a sperm fuge, and we have a laminar flow, and the entire IUI setup is there.
Great. Ma'am, what has been one incident that has really infuriated you as a doctor treating patients, the mistreatment that you saw?
I don't think, because I don't get so judgmental about anything. If I don't agree, I will brush it aside and be done with it, because I have to follow my path of it as to what I believe in the best. And really, I don't allow things to infuriate me to that degree. But yes, this ART law, which has come up now, it has its good points, it has its good side, but somewhere I feel that, they've tied our hands. Law was important for us to regulate the practice, but some things have been stopped by the law. Surrogacy can be regulated, but they've stopped it for lot many indications. Age and ED cycles, embryo donation cycles have stopped. There are lot many things in this law which has been framed. So there is a downside of it also. Regulation, yes, it was required for all the clinics, the way things were happening in the country, mushrooming of so many ART clinics. Of course, some regulation was required, but there is a downhill side of it also, which is not giving me anything better than this. No better feeling.
Care to explain more?
I'll explain. I mean, this is something which will develop with time now. This ART law rules have to be followed and all. You know that there's a law which has come up, 2021, ART law 2021.
Yeah, I read
so surrogacy is not everybody's cup of tea now. You just can't ask for it. There are some guidelines to it. One has to follow those guidelines. Earlier, for some patients where there was no sperm, no egg, only the uterus could be used. Embryo donation cycles were allowed, but now they are not allowed.
So, for example, tomorrow I want to go for surrogacy, even if I don't have a man. There are some limitations?
Yes. Only a divorced or a separated woman. Single woman is not allowed now. Single father is also not allowed.
Well, that's going to set back. That's a setback for a lot of people, actually. The other day I was talking with a doctor, and she was narrating a story about how a young couple came to her and the patient's fallopian tubes were blocked, and she advised surgery because it's a simple enough procedure. And the husband said that he would rather divorce her and get dowry and marry a new wife, because then he'll get dowry money also. And it's so infuriating to hear such stories in this age.
They are, but see, this is not only in context to infertility. Generally, also These things were always existing in our society, right? So there has to be some kind of a law to this. There has to be some kind of a rules and regulation which are already there. But how many people still, in spite of these laws there, manage to do all this?
That's true.
So this is something, a problem which is not only in context with infertility, it's even there without it or with it. Even after she's produced children, still this will happen.
This is the third time I'm bringing it up, but I strongly feel there has to be a law that protects anybody who is being divorced on the grounds of infertility. Or if somebody...
That cannot be permitted. That cannot be permitted. It should be banned.
Yeah, and like, for example, some women are called, barren women or other names when they're not able to get pregnant, whether it's their fault or the husband's fault. In those kind of cases, being called such names should also be punishable by law. That's what I feel.
True.
Well then, ma'am, this is the end of the interview. Thank you so much. And
Thank you so much.
yes, please give us the number for your...
Yes, Jyoti will give it to you. Jyoti Singh, my admin, will give it to you.
Okay then. Thank you so much.
Pleasure.
All right.